If you've ever felt burning, tingling, or numbness in your feet, especially at night, you're not alone. For many people over the age of 50, this sensation starts slowly. At first, it's just a mild discomfort, maybe a slight tingling in the toes, something easy to ignore. But over time, it changes. The feeling becomes stronger, more constant, sometimes painful. Walking becomes uncomfortable. Sleeping becomes difficult. And many people begin to worry that this is something they simply have to live with. A patient once said to me, "It feels like my feet don't belong to me anymore." That's how neuropathy often feels. Now here's what most people are told. They're told this is nerve damage, that it's permanent, that the best they can do is manage the symptoms with medication. But what many people are never told is this. While nerve damage itself can be complex, the symptoms you feel, the burning, the numbness, the discomfort, are often heavily influenced by circulation, movement, and how active those nerves are throughout the day. And that means something very important. It means there are simple things you can do, starting today, that may help reduce these symptoms, not by forcing the nerves to heal overnight, but by improving the environment those nerves depend on. Better blood flow, better movement, better communication between the brain and the body. I've seen patients who could barely stand for long periods begin to feel noticeable relief just by adding a few small exercises into their daily routine. Nothing complicated, nothing intense, just simple movements, done consistently. In this video, I'm going to walk you through 6 simple exercises that can help support circulation, reduce nerve discomfort, and improve how your feet and legs feel throughout the day. And make sure you stay with me until the end, because the 4th exercise is one that many physical therapists recommend, but most people never try at home, even though it can make a noticeable difference. Why neuropathy symptoms get worse over time. To understand why these exercises work, we first need to understand what's actually happening inside your body when you experience neuropathy. Neuropathy refers to damage or dysfunction of the nerves, especially in the feet and legs. These nerves are responsible for sending signals between your brain and your body, signals that control movement, sensation, and balance. When these nerves are affected, those signals don't travel as clearly as they should. That's why you may feel tingling, burning, numbness, or even sharp pain. But here's something many people don't realize. The nerves don't work in isolation. They depend heavily on blood flow. Your blood carries oxygen and nutrients that help keep nerve tissue functioning properly. When circulation is reduced, the nerves may not receive what they need, and symptoms can become more noticeable. This is especially important after the age of 50. As we age, circulation can slow down slightly. Blood vessels may not be as flexible. The body becomes less efficient at delivering nutrients to the extremities, especially the feet. And since the feet are the farthest point from the heart, they are often affected first. Another factor is movement. When the body is inactive for long periods, sitting, lying down, or even standing still, circulation becomes slower. Muscles are not helping push blood back toward the heart. The nerves remain less active. Over time, this can make symptoms feel worse. This is why many people notice that neuropathy feels more intense at night, because movement decreases, circulation slows, and the nerves become more sensitive. Now, this doesn't mean that exercise will cure neuropathy completely, but it does mean that improving circulation and nerve activity can help reduce how strongly those symptoms are felt. And that's exactly what the exercises we're about to discuss are designed to do. They are not about intensity. They are about consistency. Simple movements that gently activate the muscles, improve blood flow, and support the nerves in a natural way. And in the next part, we'll begin with the first 2 exercises, both of which can be done sitting down, making them accessible for almost anyone. Exercise 1 and 2. Gentle movements that improve circulation. Let's start with something very simple. Exercise number 1 is ankle rotations. You can do this sitting in a chair. Lift one foot slightly off the ground and slowly rotate your ankle in a circular motion. Make the circle smooth and controlled. Do this for about 10-15 seconds in one direction. Then switch directions. Then repeat with the other foot. This movement may seem small, but it has an important effect. It helps activate the muscles around the ankle and foot, which in turn helps push blood through the lower legs. This improved circulation can help reduce the feeling of stiffness and discomfort. Exercise number 2 is toe flex and stretch. While sitting, place your feet flat on the ground. Then slowly lift your toes upward while keeping your heels on the floor. Hold for a few seconds. Then reverse the movement. Press your toes down while lifting your heels slightly. Repeat this motion slowly. This exercise helps stimulate the small muscles in the feet and improves nerve activation. It also encourages better coordination between the brain and the lower limbs. Many people with neuropathy notice that their feet feel disconnected. These small movements help rebuild that connection. And the key here is not speed, it's control. Slow, steady movement allows your nervous system to engage more effectively. Now, you may not feel a dramatic change immediately. That's normal. But over time, these exercises help create better conditions for your nerves and circulation. And that leads us to something slightly more active. In the next part, we'll talk about 2 more exercises that involve gentle, standing movements, designed to further improve blood flow and balance. Exercise 3 and 4, improving balance and blood flow. Exercise number 3 is heel-to-toe walking. Stand up and place one foot directly in front of the other, heels touching the toes of the opposite foot. Walk slowly in a straight line. This exercise helps improve balance and coordination while also activating multiple muscle groups in the legs. It encourages blood flow and helps your body become more stable during movement. Exercise number 4 is calf raises. Stand near a wall or chair for support. Slowly lift your heels off the ground so you are standing on your toes. Hold for a few seconds, then lower yourself back down. Repeat this slowly. This movement activates the calf muscles, which play a major role in pushing blood back up toward the heart. This is sometimes referred to as the second heart of the body. Stronger calf activity means better circulation in the lower legs. And better circulation means better support for nerve function. Again, these exercises are not about intensity. They are about gentle, consistent movement. And in the next part, we'll look at the final 2 exercises, including one that can be done while lying down, making it perfect for people who experience discomfort at night. Exercise 5 and 6. Plus, final routine. Exercise number 5 is leg elevation with movement. Lie down on your back and lift your legs slightly. Then gently move your feet, flexing and pointing your toes. This helps improve circulation while reducing pressure on the lower limbs. It can be especially helpful before sleep. Exercise number 6 is foot rolling massage. Place a small ball or bottle under your foot and gently roll it back and forth. This stimulates the nerves in the feet and can help reduce discomfort. Now, here's the important part. These exercises work best when they are done consistently. You don't need to do all of them at once. Even 5 to 10 minutes a day can make a difference over time. The goal is not perfection. The goal is movement. Because movement supports circulation. Circulation supports nerves. And when nerves are supported, symptoms often become more manageable. If you found this helpful, consider sharing it with someone who might benefit. And remember, small daily actions can lead to meaningful improvements over time.